Yes, so welcome back.
Yeah.
So I know it's kind of nervous to be in front of the camera, but don't worry about it. Your goal really is to get the questions wrong right
Okay.
now, so that on the test day you get it right. Right?
Yeah.
So go ahead and feel free to get it wrong as many as possible. So these questions are not necessarily um, these are things that I think is high you that come through my mind as I speak to you.
Okay.
Uh, it might be from all over the place. There is no rim or logic to it. It's just things that come to my mind, and I'll ask you. So let's talk about. Okay, let's talk about the. Let me see. I want to get you. I want to show you these scales a little bit, so that way we can talk about them in a more constructive way. Um, so, do you remember about Yalomon group therapy?
Yes.
Yes.
Installation of hope. Um.
What's
Uh.
installation of a hope? For an
Installation
example. Yeah.
example will be like we all in the same problem together. So there is a hope that we're gonna come out of it.
Okay. And what is existential?
Existential
Hmm.
is a meaning of life.
Okay. So, existential emphasis on the importance of exploring existential issues such as death,
Mhm.
um, isolation, things like that. By addressing this function question, the therapy can help the client to develop a deeper understanding of themselves and their place in the world, just like you said. But existential is also one of the group components of the Alamo, right?
Yes. Mhm.
So, example, a patient may be struggling with the feeling of despair and hopeless. Yalamon therapists might explore the client existential concerns, such as their fear of death and their sense of meaningless, being meaningful to the world, things like that,
Mhm.
right? So, but pay attention to those two principles:
Mhm.
installation of hope and existential. These are very high yield.
Okay.
Um, what is behavior therapy?
Behavior therapy is to help the patient change their behavior.
Hmm.
Um,
Yeah, that's it, right? Is the type of psychotherapy that focus on unwanted behaviors
yes.
through learning new skills and coping mechanism, which is different than CBT. What is CBT?
CBT
Actually, I'm sorry. So before we actually go any further, I want to go back to behavior therapy again. So think a bit about the principles of behavior therapy. Classical conditioning, which is involved the association of a natural stimulus with the conditional response. For example, this might be a little bit too much, but I just want to give you a little bit more on behavior therapy. A
Mhm.
person might learn to fear a particular situation because it has associated with a negative experience. So, taking a test that you failed before, you might be very anxious because of classical condition. You felt bad during the experience. So that would be an example of classical condition. Operant condition would be something like changing behavior through rewards and punishment. For example, a person might be more likely to repeat a behavior if it is followed by a positive outcome, such as praise and attention and rewards,
Mhm.
right? So the classical will be like a negative symptom. Oh, I get a bad response. Operant would be a positive reinforcement. I get something good if I do it. or cognitive behavior therapy, which is the type of behavior therapy that combines the behavior techniques and the cognitive techniques to address the thoughts, feelings, and behaviors. Maybe
Yes.
a little bit too much, but I just want to give a full
Yeah.
disclosure on that. So we address, we already address existential therapy. Let's talk about see here. What do we want to talk about? Is parallel play would be normal, abnormal, and what age would you see that?
Up to 6 years old.
Okay. So is it normal? Is the normal stage of social development that typically occurs between 2 and 3 years old, right?
Okay.
Parallel.
Okay.
During this period, the child plays alongside others, engaging in similar activities, but not interacting directly with one another. So they are playing together,
Hmm.
but not really interacting a whole lot together, right?
Yes.
So the parallel play is common stage of a social development. Is important to know that the child's social development can vary. I mean, absolutely, right? So some children may begin to show signs of parallel play early, while others may have a little delay. So that's what it is, parallel play, right? So
Yeah.
here are some signs that well, let's not go over signs, but that's parallel play is normal, meaning when they get older, they should not have those, they should play along, not
Mhm.
just beside each other. Um, what is, do you remember about Huntington disease? Do you know anything about that? Like in
Huntington disease.
yes,
Huntington disease is subcortical,
okay,
and you can use a gene testing.
very good. So here, is a progressive neurodegenerative disorder caused by inherent genetic mutation,
Hmm.
right? So this is abnormal movement, cognitive decline, and psychiatric symptoms.
Yes.
So important thing is that knowing that this is a generic risk for a column HD, right? So it's a genetic condition. So if a dominant one copy of the mutant gene is needed to develop the HD, I don't think that's they are going to get in too much into this, but typically occurs between the age of 30 to 50 years old, more so. So it's later on in life. All right.
Hmm.
So genetic. That's pretty much what I wanted to get to it. We talked about the Tarasov principle. Who you call first. It depends, right?
Yes.
Acute opioid withdrawals. Uh, if you see someone with dilated, let's see, what a let me see what questions I want to ask you. Um, so, like when the mother calls the child and the child does not respond, so that's the lack of mirror neurons.
Yes.
Okay, so understand that. What do you know about Native Americans who is 19 years old and commits suicide? What would you say that?
Um, the
What do you say?
native the Native American, they accept societal, and
Mm-hmm.
they are um, they uh, they are the race that has the highest societal attempt or societal ideation, and they have alcoholism problem.
Okay. Very good. So let's say that a patient comes to you for a scheduled appointment and verbalizes to you that he or she feels terrible, and he thinks that the group home where he lives is trying to poison his food, and that he thinks about setting the house on fire while everyone else is at sleep. How would you respond? Would you challenge the thoughts? Would you call the group home staff and notify law enforcement about the homicidal thoughts? Would you provide the reality orientation and reassuring that he is safe?
I will call authority.
Okay. Call the group home and staff and notify the authority. Oh, yes,
Mhm.
absolutely. Um, okay, let's see. What do you know about PGE1 injections?
PGE.
E1.
I have no idea on that.
Okay. So like PGE1 injections, right?
Uh-huh.
So often given for erectile dysfunction.
Oh, okay, yeah,
So
yeah,
do you kind of remember anything about that?
yeah. They are rapidly absorbed.
Okay. So yes, um, rapidly absorbed. So okay. So but how would you, if the question is about how would you give it to the patient, how would that be? Gradually, fast, slow, rapidly?
Uh,
The application of the injection.
Application of injection, it will be slow since it
Very
is
good.
rapidly
Yes.
absorbed.
Yes. So slow, rapidly absorbed. So absolutely right. Right.
Mhm.
Um, Now, if you want to educate about the absorption, it would be rapidly and fast absorption. Right.
Yes, rapidly and fast as absorption.
Okay.
Okay.
So, what would you think of a child that's in foster care? It's doesn't associate with others and doesn't socialize. What that child would be most likely? Um,
Detachment,
Say it again.
detachment.
Yeah, detachment disorder, right?
Yes.
Okay. If the couple says that their stepchild is disturbing them by intentionally having aneurysm, what would you be your best response?
Um, hmm.
It's kind of hard, right? But
Mhm.
would you say tell the child to decrease drinking water after dinner, alarm clock reminder, or urine,
Alarm
urine
occur.
tap, or do or initiate a family contract or family? member will where the family member will agreement before father assessments.
Um, Alarm clock.
Okay, so you are focusing on the child here, but
Okay.
the question says the couple reports that the stepchild is disturbing them by intentionally having unerism, right? Uneresis, sorry. Uh, so there is something wrong with the couples here, right? They say,
Yes.
hey, this is intentional. They're doing this to disturb us. So what you really want to do is focus on the couple rather than on the child. So in this case, you do or initiate a family contract of
Yes.
the family will have an agreement before father assessment, right?
Yes.
So those
Yes.
type of agreements is like to take care of the child and protect the child and things like that.
Yes.
Okay. So when you have option A, B, C, and D, and this for suicidal ideation, how would you treat these options? How would you pick the right option for the one that has highest risk for suicide?
I will count how many symptoms they have, and
Okay.
the highest symptom will be the highest suicide attempt.
Okay. Which part of the brain or frontal cortex will most likely be affected by executive functioning? Is the dorsolateral? Is this the orbital frontal or another option?
Is a frontal, so it will be dorsolateral.
Dorsolateral. So orbital frontal be more impulsivity attention, okay? So I want you to know that dorsolateral is executive functioning.
Dorsolateral.
Orbital frontal will be for impulsivity and attention.
Okay. Okay.
Okay. Which sorry, which pathway is involved with Parkinson?
Parkinson.
Yeah, Parkinson symptoms.
Um,
Which
yeah,
dopamine pathway?
is uh, we have a mesolimbic, mesocortical, um cortical, limbic, and oh my god, limbic, cortical. My brain just went blank.
Okay, it's okay. So you have mesolimbic,
Mm-hmm.
mesocortical,
Uh-huh.
nigrostriatal.
Nigrostriatal, yes, nigrostriatal pathway.
Okay, so what happens in a nigrostriatal pathway?
Nigrostriatal pathway, the dopamine is blocked and it causes EPS.
Okay, so what goes up in a nigrostriatal pathway?
Nigrostriatal pathway, the dopamine is is down and acetylcholine is up.
Okay, all right. So, okay. So when you have a patient with Parkinson, which neurotransmitters involved with Parkinson?
Parkinson, we have a dopamine when we have acetylcholine.
Okay. Okay. So the problem is the here for Parkinson, real Parkinson. The problem is acetylcholine, right?
Mm-hmm.
Okay. Now, what happened to the mesocortical pathway?
Mesocortical pathway, the dopamine blockage there give a uh, negative symptom. At
Okay,
the
very
low
good.
here, yeah.
Very good. What is the first line antipsychotic treatment of a choice for a first breakthrough episode? A. Haldol. B. Thorazine. C. Celexa. Or D. Invega.
So we have Haldol, we have a Torozine, we have
Celexa
Delisa,
or Invega.
or Invenga.
Hmm.
I would take Invega.
Okay, Invega. So why?
Invega is atypical.
Okay. So atypical, what's the difference between atypical and typical?
Atypical are the serotonin, and they are they are lesser with EPS.
What do you mean by serotonin?
Um,
What's the receptor name?
the 5A2A.
A.
Yeah,
Okay. So 5A2A. So there are less EPS symptom, but there are more what?
they are more of increased metabolic syndrome.
Okay, very good. Very good. So like if someone has developed EPS symptoms early, they are most likely to develop what later on?
They are more likely to develop tardy dyskinesia.
Okay. Okay, very good. Right. So let's say you have a 80 years old patient that was diagnosed with Alzheimer's 3 years ago and scored 77 on his MMSE. And he come to you and the score is 26 on the MMSE. What diagnosis will you give this patient? Severe dementia? Call the doctor and tell him that he misdiagnosed the patient. Reconsider diagnose him with the Alzheimer, or I don't know, another option.
I would say it's mostly misdiagnosed because it's so close.
Right.
Yes.
Absolutely misdiagnosed. Right. So 3 years old was 27. Now it's 26. So most likely misdiagnosed. Absolutely. So let's say you have a depressed lady who has marital conflict and comes to you that she is interested in therapy. However, she would like to engage for 2 to 3, 4 months, um, or even longer, what would you suggest? What kind of a therapy would be helpful for the couple?
I know it, but my brain is not taking it right now. Can you give me choices?
So, exposure therapy, interpersonal, short duration therapy, and psychodynamic.
Interpersonal therapy.
Okay, interpersonal therapy. Okay. All right. No problem. No problem. A young lady who agreed for treatment, however, is concerned about weight and would now want to be on medication that will cause her to gain weight. Which medications would come to mind that you could possibly help this patient out?
I built. What was the diagnosis?
Yeah, so basically you're looking for medications that has the least weight gain. So what medications would come to mind?
It was it depression or was it
No, no, it doesn't really matter. You're
why
looking for medications that are least weight gain. What would come to mind? Like
Abilify,
Abilify, Latuda, and Geodon.
and Geodon? Yes.
Okay, so out of those three, which ones do you have to take with food?
Abilify, Geodon. I am not sure of that.
Okay, so Latuda and Geodon you need to
Okay.
take with food. Okay.
Okay. Okay.
All right. So if the question is about antipsychotic for weight neutral, right? So you really need to read the questions before answer. Okay. If it
Mhm.
asks about mood stabilizer, you want to pick Lamictal, right? If
Yeah.
it's for weight neutral. Now, if the question says someone gain weight on antipsychotic and it comes to you, but the patient been stable, right? And recommend which of the following would you do next? And one is an option to change to Lamicto. Another option is to stand to Latura or Geodon or suggest a lifestyle change. Which of the following would you pick then?
Is if it's the first time, I would do lifestyle change first.
Okay. All right. Sure. So the point that I'm trying to make here is that if somebody is stable, right, and they comes to you and say, "Hey, um, life is going well. I'm stable, but I have gained weight. Do lifestyle change first before you do medication." Okay.
Yeah.
Okay. So if a child is on a amphetamine and develops stick, so which medication would you switch despite of having a very good uh despite of having a very good results with the stimulant? The question says, hey, Johnny improved tenfold. He is now pay attention. He's the number one student in class. The mother is very happy. The students are happy. The class is happy. However, he develops some tick. What would you do?
I will stop the medication
What
and
would you provide instead? Give me three options.
I can give Stratera.
Okay, Stratera is the best option, but also guanfacine and clonidine.
Nadine,
Or
yeah.
clonidine, okay?
Mhm.
One of the threes, not the three, any of the three together. So if the patient comes in, it's on Kava, the herb medications.
Mhm.
What medication would you educate the patient to avoid while taking Kava?
while on cover, you should avoid any medication that will sedate you. So
Okay.
benzos,
All right. What are the other things that are you would you be worried about cover?
is liver toxicity.
Okay, so check LFTs.
Yes. Mhm.
Okay, which herbal medication will reduce the effectiveness of levodopa?
It will reduce the levodopa.
Yes,
Hmm.
kava.
Kava kava. Okay.
All right. So three things about kava: don't give benzos, check LFT, and reduce the effectiveness of levodopa. Okay.
Levodopa. Okay.
So let's say you have older females that have a decrease in sex drive. Which hormones would you check for? Like mainly,
Testosterone.
yeah, testosterone. Okay. So if a patient comes in your office and says that he feels funny and he has been sniffing acetone, what would you do?
Check urine drug screen.
Okay, and send to the AD, correct?
Yes. Mhm.
Absolutely. If someone has dementia and they have a Lewy body, what symptoms is the telltale sign of Lewy body?
Visual hallucination.
Okay, between 7 and 8 years old, who is in school and there's a and the boy is having trouble because he is a woo. Let's see. Let me see. How can I say this? I don't know how to ask a question like that. Let me see. So let's say like a woman with a 22 months old. The baby kind of hand out and then kind of grabs your finger, the palm or grasp, right?
Mm-hmm.
Is this normal or abnormal for 22 months old?
Is abnormal.
Okay, so refer to neurology and do an X-ray. Absolutely, right?
Yes.
So, so you have a 12 years old who has abstract thinking, does school project, science project, and journals. Which likely stage of PAG would this person be?
That would be formal operation.
Okay, very good. Now we have a 12 years old and they are giving you example of ice to water and water to ice conversion. What stage of PAG would this person be?
Ice to water.
Right, like the transformation ice to water and it's still same thing.
That's a science. So concrete.
Concrete, yes.
Mm-hmm.
Right, so that's understanding, but it's not very deep. It's not
Mm-hmm.
like a science project, right?
Yes.
It's not like an hypothesis.
Yes.
Is a it's a concrete thinking. C is before F.
Yes.
F is the form, so it's the last
Yes.
stage. Okay. So if you have a client who is attending a group session, and the group is kind of like talking about things, and he does not want to attend, he doesn't want to attend the group anymore. So what would you do with
I,
this?
I will try to encourage the patient to do, but have a one-on-one with the patient also.
Okay, very good. Okay. What is the thought process or effect of someone with schizophrenia?
The thought process of someone with
Or
schizophrenia.
effect, or effect,
Mhm.
how would someone with schizophrenia would look?
They will be either depressed or hallucination.
Okay, so they'll have like a flat effect,
Yes.
right?
Mm-hmm.
And the thought process will be very concrete, right?
Concrete. Okay.
So, so if you have someone with schizophrenia and you get an MRI, what kind of change would you see?
Everything decreasable on large ventricle.
Okay, okay. So, a 70 years old who is anxious, what part of the brain is involved? Um, Hippocampus, anterior cingulate, uh, or C, frontal cortex.
Mm.
Hard question, huh?
uh, Hippocampus.
Uh, so kind of like a anterior cingulate would be the most likely option here, right?
Okay.
So yeah, anterior cingulate would be the best option for out
Okay.
of these. Okay. See what else. So if you have um if you have a scenario where a child who is in school died, and you are called to give a presentation in school, what are the things you be most concerned about?
I will be concerning make sure that we have a larger audience and also make sure they are not normalize the death.
Right. So it depends how's the death, right? If it was a natural death, then you want to normalize. If it was suicide, you do not want to normalize it.
Correct.
Okay, so death happens, but if it's because of suicide, we cannot be like, oh, that's normal, right?
Mhm.
Okay. Which level of prevention is is the socialization of schizophrenia? So reinstating schizophrenia in society, is this primary, secondary, tertiary, or maintenance levels of prevention?
Okay. If they are in the society, it will be tertiary. The
Okay.
third. Mhm.
Okay, so what's this? Give me an example of primary levels of prevention.
The primary will be uh, screening.
Okay, primary. Okay, no. So
So that's secondary. Secondary
yeah, S
screen.
is for screening.
Yes.
P is for primary, right? So what's on the P? Prevention.
Prevention. Yes.
Primary
Yes.
prevention.
Prevention.
Secondary is screening.
Screening.
Tertiary is rehabilitation, right? So
Rehabilitation.
there is no maintenance phase. That's a
Yeah.
makeup thing. Okay. So give me an example of primary levels of prevention.
Primary level of prevention will be having uh, class for to prevent uh, suicidal. I don't know.
Hmm. Okay, so anything that prevents a class,
Mhm.
education. Now,
Edu-
what is a secondary level?
The secondary level will be like a vaccination.
Okay, vaccination. What else?
Um, what else can I? Screening,
Okay, screening for what?
screening for screening for like smoking. Yes, teenagers. Make sure you screen teenager to make sure that they are not smoking. Screening for um, any kind of a screening.
Okay, so I wanted to go back a little bit a minute ago. You said vaccination. Vaccination is primary or secondary?
Vaccine will be secondary
How come?
because if we give vaccine, we're gonna prevent outbreak of anything.
Okay, and you said prevent. P is for prevent.
Yes,
Whether the P falls under, is it, are we screening or are we preventing?
we prevent
So preventing is first or second level?
first level.
Okay, then. Okay, so P is preventing, right? So P is to prevent. So vaccination
It's a prevention.
is a prevention, right? So it helps prevent.
Mhm.
Now, if I call the Christ hotline and I said the building just went down, would that be primary, secondary, or tertiary?
If you call the hotline, uh, that will be prevention.
So I said that call the hotline, a building just went down.
Oh, building just went down. That would be a secondary.
Okay. If I call the hotline and say that I am having suicidal ideations, would that be primary, secondary, or tertiary?
That would be secondary.
Okay, so calling the hotlines would never be a primary, right?
Yeah. Yes, it can never
Okay.
be. Yeah.
So you gotta really pay attention and ask yourself where does it fall into, because the questions can be very tricky and they may not be very straightforward. Okay.
Mhm.
All right. So if you have someone that's afraid of medication and has major depressive disorder and really wants a alternative method, what would be one that you can suggest as evidence base?
Therapy.
Therapy, sure.
Mhm.
Uh, that's a good option. But like other than therapy, what would be others?
Other than therapy, yoga.
Sure. Okay. We have too many to give. Would you suggest acupuncture?
Yes, but what I know about acupuncture is mostly for pain.
But it can also be for major depressive disorder.
Okay, okay.
Okay.
Hmm.
But yes, for pain, for sure, right? There are many things in which acupuncture is good for, right? But
Okay,
if the patient wants acupuncture, or it's possible to have acupuncture, right? So that would be an option.
okay.
The scope of practice is from who does the scope of practice?
The scope of practice is coming from the state.
All right. Who does the standard of care?
The standard of care is coming from Anna.
All right. Very good. So let's say a client with a borderline personality disorder is depressed. What are you going to treat him with? MAOIs, TCA, SSRIs, or SNRIs?
Borderline personality. There's
Yes, but I said depressed, right? So
oh,
you're treating the depression.
okay, treating the depression. I will use SSRI.
Okay, very good. Yes, that's right. A patient is going through a residential and an IOP program and has history, let's say, of alcohol use and depression. When he is depressed, he just drinks and stays alone. What would be a barrier to him going to a lower level of care? Let's say the lack of support system. He will use a therapy twice a week or using alcohol to treat depression.
Um, they most likely use alcohol to treat the depression.
Yes, absolutely, right? Or how do you know when the patient is ready for discharge from an inpatient unit? Totally different case, but similar.
Mhm.
What kind of tell signs would they
If
give?
if they no longer blaming other people for their behavior.
Very good. So let's say a patient lost a friend uh, last month, but now he's experienced paralysis. What uh, what would be most likely the condition that we would most likely be the diagnosis?
Conversion.
Conversion disorder, right?
Mm.
Um, Patients on Accutane and pregnant, what would you do?
We stop the Accutane.
Okay, Accutane. All right. Okay. What is appreciative inquiry?
Appreciative inquiry. Mm, do I have a choice?
No, not this one. No choice. But think about like things that we learned, right? Um, this one is a bit loose, but um, think about what does it do to the organization. Like why would we use appreciative inquiry to make change?
Yeah, to make a change, to see improvement of
Sure.
care. Hmm.
So appreciative inquiry is a positive organization change that focus on building on strengths and positive experience rather than dwelling on the weakness or problems. So, it helps the organization to identify and amplify what works well rather than and that leads to more engaged employees, improved performance, and overall organization health,
Yeah.
right? Some principles up there. Uh, some principle that's important. Okay, the appreciative inquiries.
Mm.
Uh, we say inquiries, right? Asking open-ended questions. What's working in the organization? Then dreams,
Mhm.
which is envision a possible future for the organization. Then the design, which is creating strategies and plans to achieve a desired future, and destiny, which is taking action to implement the plans and realize the vision. So appreciative inquiry, you should write down
Yes.
dreams, designs, and destiny, and inquiries.
It's about.
Um, yeah, so basically, when you hear appreciative inquiries, think about building on what worked in the past rather than dwelling on what did not work.
Okay.
Okay, important there. Um, let's see, what else can we talk about? So we talked about the patient being aggressive in AD. What kind of medications can you give to the patient? Give me
Uh,
some options.
we talk about giving the geodon.
Geodon.
Mhm.
Okay. Geodon, Ativan, but if you give Ativan that doesn't work, you can give Geodon, or you can give Geodon first. Okay.
Mhm.
Very good. Flonase and taking Depakote. Patient taking Flonase and Depakote. What will happen, or most likely will happen?
So it's gonna decrease the effect of Depakote.
Say it again.
It's gonna decrease the effect of Depakote.
Okay, very good. So what you have to do?
You had to increase Depakote.
Okay, very good. So Flonase is a steroid, right? So sometimes they will not say is a Flonase. They will not say it's a steroid. So you have to realize that steroids can cause mania, which can cause, which cause Depakote to be ineffective, right? So you kind of need to increase the dose in that case.
Yeah.
Um, patient, you prescribing some Risperdal to treat OCD off label. What do you make yourself do? Like, let's say you prescribe Risperdal for whatever reason, let's say off label for OCD. What what are the things you have to do?
I had to explain them that the full description of the purpose of the medication, give a full description and why I'm using it off label
Okay, and document, right?
and document.
Educate the patient, document that's off label.
Yes.
Okay? Um, let's say a patient is lost weight and also having insomnia. What medications would you give to help the patient eat more?
To eat more.
Yeah,
Uh,
increase appetite.
Romeron.
Romeron. Okay, very good. So Romeron for insomnia and one that needs to gain weight. So very good. Let's say a patient taking Effexor and have read about PCP, right? Uh, let's see. Effexor, it could show up as a positive for PCP, right?
Yes. Mhm.
Okay, that's what I kind of want to get to it. If you will conduct an MMSC on an elderly patient and is unable to draw a clock, which part of the brain is most likely affected?
Right parietal
Or,
or right hemisphere.
okay, if a patient comes to the hospital asking to renew his medication, what level of the prevention would that be?
Criteria.
That area. Okay. What medication would you prescribe if someone is on lithium for long term.
Thyroid medication, Centaur.
Okay, very good. But understand that this is not that you can't just prescribe Centroid, but if you cause the problem, right?
Yes.
Then you
Yes.
can fix it, the problem. You have the right to fix it. You
Yes.
wouldn't necessarily say, "Hey, go to somebody else to manage something that you caused."
Yeah.
Okay. Let's say a patient comes with a history of anorexia and has not been eating for days. Now started eating again and complained of stomach ache. What was the cause of that?
A delayed gastric emptying.
Sure, but that wasn't what I was looking for. But that's close enough, right? Refeeding syndrome.
Refeeding syndrome. Yes.
Refeeding syndrome. Okay. Well, now let's talk about your favorite uh, condition, ODD, right? You talk about ODD all the time. So, ODD. So, what are things that what kind of therapy do you want to uh, give for the family or parents of kids for ODD?
ODD, you want to do
Yes,
parenting therapy?
skills.
Yeah, to
Parent
prevent
skills, right? Parent skills. And do you also want to set limits,
limits.
logical consequence, and consistency, right?
Mm-hmm.
Okay. So, so if you have like a woman in the military and she went to war and saw her friend die, what most likely would be the diagnosis?
PTSD.
Okay. What should you watch out for someone taking Targetol? What are the two? Um, well, there are more than two, but at least two conditions that you should watch out for.
For Tegretol, we want to watch out for uh, uh, what is it? Tegretol.
Targetol is carbamazepine, right?
Carbamazepine. Yes.
So what are the two conditions that are mostly really it's three, but that are mostly concerned about when I'm prescribing Targetol or carbamazepine?
Agranulocytosis.
Yes, that's one. What's
Uh,
the other?
uh, we want to also monitor the WBC.
Sure,
Uh-huh.
but remember carbamazepine has three A's.
Yes, Asian population.
What's
Uh,
the other A?
uh, Agranulocytosis, Asian, and
It-
aplastic anemia.
Okay, very good. So agranulocytosis and aplastic anemia, but I want to highlight this too.
Okay.
Hyponatremia. Hyponatremia. Okay.
Natremia. Okay.
Yeah. So agranulocytosis and hyponatremia, high yield as well. Okay. All right. What is the impact of steroid inhaler on children? What does it do to them?
Impact of steroid on children.
Yeah. What
Um,
does steroid do to children usually, right?
mm, is a cause weight gain
No, it's slow bone growth and
or
decreased uh, weight, height. Okay.
high? Okay.
Okay. So if you have what alien is seen with Asian population that increase the risk for Stephen Jones syndrome?
Alate 1502.
Okay, very good. Um, what is included in the treatment of fibromyalgia? Let's say A, sleep, antidepressant, and pain medication. Uh, I don't know, like, so that's one of the options, right? But also Zimbalta effects or Elivior, Polymor, or Lyrica, gabapentin can also be um, options for fibromyalgia, right?
Yes.
What is common to patients with fibromyalgia, right? Sexual abuse. It would be one of the possible answers because that's, that hurts. They don't want
Okay.
to do that,
Yeah.
right? And then there is the problem with sexual abuse. Okay.
Okay.
If you think of someone that has infiltrated the church because he watched on TV 2 years ago, uh, if someone thinks that someone has infiltrated the church because they saw this on TV 2 years ago, what would be the likely diagnosis here that I'm talking about? This is a delusion disorder. Maybe the
Delusion.
yeah,
Yes.
the question um
Mm-hmm.
wasn't very well put. So, patient comes with vague symptoms of depression, irritability. What kind of scales can you use to kind of verify those symptoms?
We can use PHQ-9. We
Sure.
use HEM-D. Uh,
Okay.
we can use uh, HEM-D, PHQ-9, and
The back depression
the back,
scales.
the back, yeah.
Okay. So let's talk about ODD. What will you do to prevent it from becoming a conduct disorder?
Parent
Okay. So what is the target for the therapy?
is to to set boundary,
Okay. So basically mood and aggression.
mood
Okay.
and aggression. Yes.
NSAID, dehydration, and thiazides increase the risk level of what medication?
Lithium.
Lithium, right?
Mhm.
So gotta be careful. So, ooh, what is? Ooh, that's a hard question. Like I had here in my notes, see a few things about this, but what is? Let's say I don't know if I covered this or not. What is the Mental Health Parity Act of 1960? Do you remember?
That's when they want to make sure that medical, the way you treat medical, like if you the same right for medical is given to psychiatric.
Yes, absolutely. Equal lifetimes and annual limits is absolutely right. I didn't remember if I covered that well or not. So if you have a menopausal woman, what kind of treatments would you be able to provide for that?
Um, Give them hormonotherapy.
Sure, hormonal therapy, right? So if a patient has a Risperdal and develops NMS, which other atypical should be avoided in the future? Atypical antipsychotic.
Uh, Which one in particularly?
Yeah.
I am not sure on that.
Okay. So Zyprexa.
Zyprexa. Okay.
Yeah. So neurological malignant syndrome is a rare but potential life-threatening side effect of
Zyprexa.
antipsychotic. Yeah, antipsychotic medications include the Risperdal. And if a patient develops NMS while taking Risperdal, it is generally recommended to avoid another atypical antipsychotic in the future, as they carry similar risks of NMS, right? So other antipsychotics, it could be, Zyprexa and so forth. So if a patient experiences NMS, it's can be serious, right? So we probably don't want to do another antipsychotics. Okay,
Okay.
so how would you determine the readiness of hospital staff to implement changes?
The readiness of hospital staff to implement, if they are not opposing to the changing.
Sure, but how do you determine? What do
uh,
you do?
you do plan, you
Right.
assess
So survey first, right? Fill
survey.
out the survey.
Yes, survey.
Okay. Macro anemia. What do you give for macro? MACOR anemia.
B
Microlytic anemia. Microcytic anemia. Microcytic anemia. What do you give?
vitamin B12,
And
folate.
vitamins 12 and folic. Okay. For that diabetic patient is having pain, what medication would you could possibly provide?
We can give we can give why my brain? Yeah, we can give Lyrica or gabapentin.
Okay, what is the cluster medication of these two medications? Do you remember?
Yes, they are what's the class for them? Um I know.
Okay, let me help you out. Is that okay?
Yes, please.
Alpha delta ligand,
Yes,
right?
alpha delta.
Okay, all right, very good. MP is being sued in court. Um, could they use the EHR?
Mm.
Can
If
they,
they
can they, yeah, go ahead.
they been sued
Yeah,
and um and I mean they have to provide their documentation.
correct, right? So they can use the HR to see what happened.
Mhm.
Now, if you think of an early sign of Alzheimer's, what kind of condition comes to mind, or signs comes to mind, symptoms comes to mind?
Uh, Cognitive center,
Sure, cognitive symptom, memory decline,
yeah,
correct?
memory decline. Mhm.
Okay. Uh, So if you're having someone that's from Zimbabwe and is having difficulty understanding you, what would you do?
Um, you use provide language interpretation for them.
Yeah, interpreter, right? You
Yes,
call an interpreter, right?
yes.
So if you have a child with bipolar and kind of depression, what would you do first for the child?
For a child with what?
If you have a child that has a bipolar uh, and depression, what would be how would you start the treatment for this child? What would be the first option?
Um,
Okay, let me help you out because the question is pretty difficult. So basically, you want to start psychotherapy if it's a child, then you want to start the treatment before medication if you have a choice, right? If
yes,
you have a choice. So I always start with the child the least um, abusive option.
yes.
So, all right. So if you have someone that's incapacitated, right?
Mm-hmm.
You want to involve ethics committee. Ethics committee.
Mm-hmm.
Okay. So um so if you want to prevent osteoporosis, what would you recommend?
I recommend vitamin D and exercise and avoid coffee, avoid smoking.
Okay. Very good. So weight bearing exercise, right?
Very exercise, yes. Mhm.
Okay. Um if you have someone with a frontal lobe injury, what kind of behaviors would you see?
They will have inappropriate behavior.
Okay, very good. Inappropriate behaviors, absolutely.
Mhm.
So if a nurse was attacked at work and has been 3 weeks and does not want to return home, what is the most likely diagnosis?
Acute stress disorder.
Okay, acute stress disorder. Okay. If you have a child with autism and not responding to the parents anymore, what could that be due to?
Neuron mirror.
Okay. All right. So the due to the mirror neuron of the brain, right? So it's a theory. It's really only tests for the test purpose. In real life. We would never talk about this.
Mhm.
Um, so if you have an elderly child now, been in a hospital for a week, now starting having a delirium, what would be your first action? What kind of labs or what things would you ask for?
I will order UA because usually they have problem with uh, UTI.
Yes, UA. Okay. All right. Okay, I can do a little bit more before I have to go.
Okay.
Uh, so, child in foster care, so reactive attachment disorder.
Yes.
Okay, a client grieving over loss of a husband. You want to utilize. Okay, so Okay. So you want to like do quick, brief therapy,
Yeah, brief
right?
therapy. Yes.
Okay. So, like, if a EP makes a decision for a patient that's not capable of doing so, and there is no family present, which ethical principle would that be fall under?
Uh,
Is it veracity? Is this autonomy? Is this beneficence? Or is this justice?
beneficent.
Beneficent. Okay, very good. Let's say you have a MP notices a team with the SI and diabetes presents with multiple times with DKA and leaves without a cycle screen, right? What are the things that you kind of want to collaborate?
Yeah.
Well, collaborate with AD to provide cycle screen and prevent this from happening, right? That's
Yes.
collaboration is very important, especially in real life and also for the test, okay?
Yes.
So if a patient presents so irritable and depressed and labile mood, what are what kind of tests would you administer? Or what's the name of the test? Or yeah.
Um, screen for suicidal or
So what I was trying to say is a mood questionnaire.
mood questionnaire. Yeah, mood.
Mood questionnaire, right?
Yes. Mm-hmm.
So if you let's say you have a client that comes to you that's restless, anxious, a state that she was raised while, while coming to your office, what would you be your first response?
Her safety.
Yeah, make sure it's safe. It's not collecting labs and any of this stuff. Make sure that she's safe to or reassure that she's safe to now, okay?
Mm-hmm.
So indirect versus direct processing of starting a business, right? So you want to educate on the cost versus revenue. Kind of one of those things that like if you want to start a business, you want to make sure that you have a budget in place for those that want to start their own practice.
Mm-hmm.
So if you have a 4 years old that's reporting dreams of monsters fighting in the sky or something like that, um, is this normal at this age to
Yes.
develop magical thinking?
Yes.
Yes, right?
Mm-hmm.
So you want to assess for family
Family.
history as
Yes.
well, right?
Mhm.
Um, sorry, I'm kind of thinking what else can I ask you? So a family in crisis, what does the MP do on the initial interviewing?
Family crisis.
Yeah, the family is in crisis. Um, what would you kind of want to get on the first? Well, basically, what I'm saying is like when you have someone in crisis, you kind of want to do a brief therapy, but you also want to find out what worked in the past.
Okay.
What worked in the past. Okay. We talked about ACE inhibitors also being used for cardiac failure.
Mhm.
Let's say a patient is not right. They let me get treatment because they think I can't afford it, with the principle. What principle would that be violated?
Justice.
Justice, right? So if the medication is too expensive and I don't offer the patient because it's too expensive, that's justice, right? It's not for me to involve that. So let's say about Native American with schizophrenia does not want medical treatment and wants to use a spiritual counseling after what the MP would do.
They will obtain a consent to make sure that the spiritual person can be there. So you have to get a consent to allow that person.
Okay. Um. So what is the key principle for GAD?
Guard for anxiety.
Yes.
Um,
How long does it need to? How long do I have to wait?
6 months.
6 months. Okay.
Yes.
So if a person was diagnosed with the zoster herpes 3 weeks ago and now present with depressed and had the loss of her job, what condition would that be? What
Uh,
diagnosis would that be?
disorder. I,
Adjustment disorder. Okay. So child with ODD reinforce firm parenting skills.
yeah, parent
Okay.
care. Yes.
Yes. Okay. Your favor. Yes. Uh, so we talked about a 14 years old boy with increased breath in distress because his 11-old sister has
Oh,
breath
yes.
bigger than him, so it's kind of normal.
Yes.
Depakote and lamictal. Depakote and lamictal. Lamictal will do what? Well, Depakote and lamictal. So lamictal will double, right?
Yes.
So which could cause Steven Johnson syndrome. So if you have a question with Steven Johnson syndrome, you have to see if it is an Asian population, pick carbamazepine. If it's not, pick Lamictal. Now,
Lamictal.
if the patient is on Lamictal and Depakote, you have to reduce Lamictal by 50%.
Okay.
Okay. So if you have a 73 years old patient wandering, disorienting, and hallucinating, uh, most likely he has delirium, and you run UTI, get labs, things like that.
Yes.
So antacid alter absorption of antipsychotic medications. How long do you have to wait until you give another medication with
First.
antacid? 2 hours, right?
Uh-huh.
Um, Patient presents with a evaluation of suspected dementia, cognitive intact, with symptoms of depression, and answering "I don't know" to the screening test. What would you? What would be the most likely diagnosis?
Depression.
Depression or pseudo dementia, which is depression.
Mm-hmm.
A patient with 20 years IV drug use starts showing signs of cognitive decline. What test should be ordered?
HIV.
Okay. A patient on Risperdal and Raglan.
Respirador and Reglan. It will cause. It will decrease the. Are you there? It's frozen. I don't know what happened.
No, I said Religan can cause TD, tardive dyskinesia, right?
Uh-huh.
So Religan can cause TD, so that's a concern, right?
Mm-hmm.
With another medication that could also do that.
Yeah.
So if a patient couldn't sleep and has anxiety presented with his during his working phase, so you want to identify the goals
There goes.
during the working phase.
Yes.
Okay. Um, so so if you like diagnose someone with a child with an anxiety and not anxiety, ADHD, but the parents gets very frustrated and angry and anxious, what would you do at that time?
Um, at that time, I had to stop and then address the anxiety with the parents first.
Okay, very good. So we have spent quite a bit of time today. I would love to kind of do this more often with you, but I have to get going for the rest of the day.
Yes.
Uh, is
Yes.
there any pending question that I kind of you want to go over? I know it was a lot. I'll have this recording ready for you so you can review at a
Yes.
later time.
Yes.
Okay.
Thank
Any last minute burning question that I can help you with?
I think we cover a lot. I just need to sit down and do the rest on my own. So I really, really appreciate your
No
time.
problem.
Thank you.
It's always good to see you and see you progressing. Have faith, organize your notes, have all your, make sure you go back to your diagnostic test and go through the answers that you did not get it right and
Yes,
look for them in the PDF. Okay.
definitely. Definitely.
My prayers to you, and I hope that you get a successful green check.
Amen.
Ready?
Thank you.
All right,
Appreciate.
man. Have a good one. Take care.
Bye
Bye
bye.
bye.